Hello, my name is Grace Speroni, and welcome to Conversations with the ERC5. Today, I am so delighted to have with me Dr. Alyssa Almeida and Dr. Brianna Almeida from Renew Health. Ladies, welcome to the podcast. It is a double pleasure to have you with us today.
Thank you.
Thank you, Grace.
So let's jump right in to Renew Health. Tell us a little bit about how this came to be.
Sure.
And then we'll delve into a couple of other things. But I
Sure.
think this is such a great topic. So start off with a little bit
Sure.
behind the premise behind everything.
I'm Alyssa, just for clarification purposes, right?
Oh, that's
and
right.
we both have our glasses on, which is more difficult to tell us apart. But Bree and I, we have been doctors of physical therapy for 8 years now. Combined pelvic health experience together for 10 years, which is so wild to say. But really the initiation of our business plan was when we were in grad school. So Dr. Bree and I, we went to AIC and we were studying for our doctorates in physical therapy, and we had a healthcare administrative class, as most PT programs have. We developed the model of a pelvic health practice. We named it Renew Health. This is something that's been like 10 plus years in the making. And so when we graduated and worked in the hospital systems, we were not happy, and we kept going back to our little PowerPoint presentation, and we kept making changes and changes and changes. And we were like, we can do this. We can do it together. And so Renew Health, again, was 10 plus years in the making, and we were able to really get this going about 2.5, almost 3 years now.
Well, you're doing amazing. And I think it's fantastic because prior to going on, we were talking, right? Pelvic health. You didn't always hear that subject. And as I said to you, I spent like 10 years in senior living, and we would talk about that, but it was kind of like, well, it's just aging. And so that's why we have these issues. And, you know, as time goes on, all of a sudden you kept hearing more and more about pelvic health. And I know, like in my running club, that's where it was like, oh, pelvic health. And I'm like, oh, wow, we're all talking about this more. So I was so delighted when you guys opened your doors, because we're in the same building.
Yes.
So it's super exciting. But it's wonderful to see your success and to see your focus on this. And what I notice is when I come in, sometimes you have someone who's expecting, and you're working with them. And then other times, like, you have different clients and different ages. So when should someone be like seeking pelvic assistance?
Yeah.
And how do you diagnose? Like, am I having pelvic issues with my pelvic floor? When should I be working on that? Because I also see you doing exercises, and I'm like, oh, I'm okay because I do those at home. But, like, how do we diagnose this?
Sure.
And then how do we come up with a treatment plan?
Yeah, absolutely. Like you said, we do see patients across the lifespan, right? So maybe this is a myth or a misconception where a lot of our clients might come in and they might say, wow, I didn't realize that I needed pelvic floor therapy. I always thought that this was something that I didn't need to worry about until I either, had children or until I'm in my 50s and 60s, right? So truthfully, pelvic health and pelvic floor therapy can be needed even in childhood, so there are a lot of pelvic floor therapists that treat pediatrics. So I'm sure, you've mentioned that you had some children, and, a lot of kiddos might have constipation issues, bedwetting, right? So that is linked to potentially a pelvic floor dysfunction.
Really?
Yes.
Wow.
So again, it could begin as early as infancy, and we really want to make sure that people are addressing this as soon as possible.
Right. So with bracing, like pediatrics, but also again, as folks, age and now they're in teenage years and they're having difficulty with inserting a tampon or with penetrative activities and with the prolonged use of birth control, sometimes that can have some implications on pelvic health. And then again, our practice, we see a ton of pregnant folks. So mitigating symptoms during pregnancy is something that we love. Our birth prep clients are amazing. All of our clients are amazing, but working on birth preparation for folks that are pregnant and then they transition into postpartum, and so we work on optimizing their postpartum care, and then there's perimenopause and then there's menopause. And so really again, pelvic health is something that really should be at the forefront of healthcare because it has implications from again pediatrics to the older adult.
And to what you just said, I'm thinking to myself, I remember, when I was pregnant and it's like, oh my gosh, and you're always running to the bathroom. And then even after childbirth, right? And I would always say, well, try giving birth to 2 kids. This is what happens. But that's not necessarily the case.
Absolutely.
There are things that you can do to maybe regain the strength that you had within the pelvic floor. Like it's not all just part of the aging process and all the different things we go through. We can actually be proactive.
Absolutely. Yeah, we can be proactive for sure. And again, that's a lot of what we talk about during like birth preparation and like immediately postpartum. But also I think too, like the misconception that like Kegels are the answer too is like another big myth where folks are having urinary leakage, they may be having fecal incontinence, they may be having symptoms of a prolapse, and people think, oh, well, my pelvic floor must just be weak. But really, that's not always the case. In fact, most of our clients are not walking around with a weak pelvic floor. They're walking around with other issues. And so one thing that really makes our practice really unique as well is we don't use that like isolated Kegel, what's happening in the pelvic floor approach. We have a very holistic approach of looking at somebody's breathing, their posture, their spine mobility, their hip mobility, their overall core strength, their pelvic floor, their foot mechanics, how their ankle is moving. So all of those things are really items that we look at during an evaluation that really gives our clients the best results versus just this outdated kind of do your Kegels. That's something that is really, again, outdated and something that makes our practice really different and unique.
So that's fascinating because I was going to ask, so like if I'm incontinent or experiencing leakage, do I call you and then what are the next steps? Kind of thing. And, is there a set plan for each individual, or is that like what you explore as we meet and talk about what I'm experiencing? You then come up with a plan that's going to be focused on?
Right. Yeah, absolutely. So Alyssa and I, we really have a method that we follow, in our practice. But we always say that our patients' goals are our goals, right? So if you, for example, wanted to go back to running without leakage, something that is very unique in our practice is that we are going to watch you run. It sounds so simple, but in a lot of these hospital-based clinics where maybe they don't even have the equipment, the space to be able to watch someone's running form, right? So we really dissect, the whole body. Like Alyssa mentioned, we look at foot and ankle mechanics. We're going to look at how you're impacting the ground, right? We want to look at everything also outside of the pelvis as well. We have, and I know you've been in our space, we have a treadmill, we have a lot of equipment, we have a squat rack. If our patients are leaking with doing heavier squats, right, we have the ability to watch them do the activity, and that's something that when I worked at the hospital-based system, it was, a very small treatment room and all we had was a table. No equipment, no TheraBands even, no weights, right? So if a young mom, right, wants to get back to weightlifting, well, we can't really assess it, so we really definitely take a whole body approach and really look at more functional based activities.
We even have a trampoline in our clinic.
Oh yeah, we have a trampoline.
I don't know if you've
I've
seen
missed
it.
the trampoline.
All right, we'll get you on it next time.
Yeah.
You pop your head in.
Right.
We'll have you jump on the
Right.
trampoline.
So a lot of our patients' goals might be, hey, I really want to be able to go to the trampoline park with my kids, right? So in order to do that, we're going to have to get you on the trampoline, right? And watch you jump. And change your, maybe your mechanics, your breath pattern. So I think that's what really makes our practice unique, is that we really tailor each of our treatment plans to the patient,
right,
and to your goals.
And one of our core values too is clinical honesty. So when folks come in, and that was something that we really missed in the hospital setting or in like these mill type clinics where we're treating so many patients, clinical honesty I think is sometimes missing in a big corporate practice. So for us, when we started our own private practice, we were like, okay, we are going to assess the patient and we're going to tell them exactly what they need. And patients really appreciate that versus saying, oh, well, my schedule is really busy. Let's just do one visit every couple of months and see how you do. We give people clear advice and clarity surrounding what a plan of care will actually look like with us day one, so that we can tailor their goals from visit to visit to visit until they reach, again, their ultimate goal. So we always say we have small goals, we have big goals, and then we have the ultimate goal, and that is just surrounded by what our patients want to be able to accomplish with us.
That's fantastic, because you can watch how everyone's progressing.
Absolutely.
And are you attaining those goals?
Yeah.
You've worked on that together.
Yeah.
And
it's
it makes
great.
perfect sense. When you were talking about, like, when you go to buy sneakers as a runner, like, they're watching your foot strike and all that mechanics of it. And when you said that, it's like, oh, that all really makes sense to me, because it is how the whole body comes together. And it's amazing how sometimes just by sitting too long or not watching your posture, it does impact you. At least as I get older, I am finding that. Or jumping on the trampoline with the grandkids.
Right.
It's like, oh, well, before we go out there and do that, Gigi's got to use the girls' room because, I say to them, because I'm getting older, I need a little help when I'm jumping out there.
Right.
So it's fantastic that you can address these things and that we're
Absolutely.
talking about it.
Yes.
Because, it isn't coming from senior living. It was just like, oh, well, it is what it is, and people would accept it. And how wonderful that it doesn't necessarily have to be that way. We can look for a way to address this and maybe make it a little bit easier for the individual. And then you still have all that mobility and all that living to do, and you can do it comfortably without having to worry about things.
Yes.
So what advice would you give to individuals who are looking, they've got some pelvic floor questions? How can they get in touch with you? What's the best way to go about setting up a time and an appointment with you?
Yeah, absolutely. We always have people head to our website. That's the easiest way to reach us. So our website is renewhealthllc.com. And there's two options, really. Somebody might be able to, again, fill out a contact form that we can, give them a call. But a lot of our potential clients, right, they reach us on our website and they actually book a discovery call. So we always want to talk to individuals first, because it really starts the conversation. We can chat with them for, 15, 20 minutes and really figure out what symptoms they're having and how we can be, again, a help to them. So that's the best way for someone to reach us.
Thank you so much. We only have a short amount of time, but I would love to continue this conversation because I really think this is something that applies to all of us.
It really does.
And how better to address it in the early stages than waiting for it to become problematic. So thank you for joining us. I appreciate having you with us. And thank you for joining us for today's podcast. If you'd like to be the next guest on Conversations with the ERC5, you can reach us on our website at erc5.com, and you could be the next guest here at Stonegate Studios in Wilbraham.